Hello everyone, welcome to another episode of Picment Show with the Professionals. And today we have the professional Miss Sonam with us. I welcome Miss Sonam to the show.
Thank you, sir, for having me on this show and having given me the opportunity to introduce myself. Hello, everyone. My name is Sonam. I am from Muzaffarpur, Bihar. I have been born and brought up in Bihar only, and I have graduated from AIMS Patna. I have done my BSc Honors Nursing, and currently I am working as a registered nurse in a reputed institution. Thank you, sir.
Okay, Sonam, so coming to your hometown in
Yes, sir.
Muzaffarpur, so what is the speciality of the hometown?
So there are so many of the specialities in my hometown. Firstly, the first thing which comes when we are telling about Muzaffarpur is about the lychee fruit.
Lychee fruit. Oh, it's very famous.
Yeah, sir. It's
Okay,
very
so
famous.
there are so many lychee cultivation farms in Muzaffarpur, right?
Yes, sir. Yes, sir. There are so many. One agricultural institution is also there for mainly the lychee cultivation.
One agricultural institution.
Yes, sir.
Okay, so is it government running or
Yes, sir. It's government
running institution? All right, so that is a specialty of one specialty of Muzaffarpur, right? And is there any tourist spots in Muzaffarpur?
Sir, not in Muzaffarpur, but
Nearby.
yeah, nearby, like in Madhubani and in Darbhanga.
Yeah, Madhubani. So it's this Madhubani. It's a very famous place for the Madhubani
painting.
I think it's
Yes.
famous, right? Okay, so it is nearby to Muzaffarpur.
Yeah, it's nearby to Muzaffarpur.
So how long it would be? Like if we are traveling from Muzaffarpur?
From Muzaffarpur, it would be 1.5 hours.
Okay, so your current experience is now in orthopedics department.
Yes.
And you are working as a registered nurse in operation theatre.
Orthopaedics operation
So
theatre.
could you share with the viewers your experience with the orthopedics department, how it is different from other departments, and what are the challenging things on orthopedics department?
Yes, sir. Okay, I have been working in orthopedics department since 2019.
Okay.
Like I have 4
So it
years
is
of experience.
almost 4+ years of
Yes,
experience.
4
right?
plus experience. When I graduated, after that only, I got posted in orthopedics OT, and the general features of orthopedics OT are like it's mainly running on like different kinds of machines.
Okay.
Yes, there are different kinds of machines, and we are learning different types of skills.
Okay.
Like we must be
So
very
different type
skillful.
of machines in the sense what it is used to.
Like portable X-ray machines.
Portable X-ray
Yeah,
machine.
because we are needing continuous X-rays of the ongoing operations or ongoing.
So is it only
surgeries.
ongoing operation or prior to the operation also?
Sometimes, if the surgeon needs, and if there is a need of, if there is something in the mind of surgeon, he want to discuss it with other surgeons, like their juniors or with us nursing professionals. So at that time, they are doing it pre-operatively also and during the surgery also.
During the surgery. So during the surgery, I think, so on the process of surgery, so what is the progress of the surgery? Like how, up to what extent they have done with that? So to know about that, or for even in between the surgery, whether there is a diagnosis like this fracture which is not shown in the normal X-ray, but explore to that extent, and then they have identified like
yeah, for sure. Yes, sir. Like sometimes in the pre-operative X-rays, sometimes there is not that level of fracture. It's not seen properly, or sometimes the surgeons are not getting that MRI done because they think that it's not needed. But during the surgery, during the ongoing surgeries, like when they are performing the CR machine X-rays, we call it the portable X-ray machine. We call it the CR machine.
CR machine.
Yeah,
because it is on
its
the
arm
shape
is
of
like C.
Yeah, right, yeah.
That's why. So that machine, during that surgery, the surgeons find out that, oh, there is another level of fracture, and we have to reduce it. So it's very helpful during the surgery.
So starting from the the beginning time of OT, like when you have initially posted in operation theater, so what is your experience like? All of a sudden you are on
Yeah,
the
sir.
operation theater.
Actually, I was when I was posted, I was a newcomer. I didn't knew anything about orthopedics OT, but I knew about the basic general instruments and basic general protocols of operation theater. And at that time, when I was posted there, my seniors, all seniors and the surgeons, they all helped me a lot to learn so many of things. And I also started showing interest.
For a newcomer, how long it will take to learn?
Yeah,
to become an expert on your experience.
Yeah, generally, if we will see that it takes 6 months.
6 months.
Yeah, to become like pro in that cases.
Okay.
But when it also depends on the interest.
Okay.
Yeah, of the professional. That if we are showing interest in particular surgeries, and if
so you're extremely interested in orthopedic surgery.
Yeah.
So do you have any particular reason for?
Yeah, sir. One incident I am remembering. Like when I was in my student time, I was got an opportunity to present a case.
Okay.
Like of a particular fracture, like neck of fracture. Then I was presenting it in the orthopedics ward. Then a surgeon came, and when I was presenting it, he told me that, okay, your presentation is very good, but your diagram is a little bit off. Then so he told me that you come to operation theater.
No, nobody have that much skill, for all these things, like on painting and also on presentation.
Yes.
So everybody couldn't be that much multi-talented to make perfection on painting and also on presentation.
Yes, like that. So that time, that surgeon, he told me to come and I will teach you that the exact diagram, and I will teach you that your presentation will match your diagram.
Okay.
So from that time, I also started taking interest in orthopedics.
Right. So when you have presented a fracture that you found like this is the interested area of mine, like that. There would be a feeling like this is the area of interest of mine, just because I could present this very well, and I have got the appreciation as well, like that. So that is the special interest on you, right? Okay. So how about your one-day work schedule in operation theater?
Yeah, sir. Nowadays, actually, we are getting very much overload of the patient, and in the morning the schedule started at 8 a.m. only. And at that time, we are getting in operation theater, and we are making all the preparations for the elective cases.
So entering in the operation theater, like there would be general operation theater.
Yes.
There would be operation theater for orthopedic surgery.
Yes, sir. Orthopedic surgery.
There would be other departments as well.
Yeah, there are.
Is there any difference in while you are entering in orthopedic operation theater and other department or general, like that? Is there any difference, or is it the same?
No, sir. During entering, there are the structural. There is no difference.
Okay.
In the structure, there is no difference. All the operation rooms are like same, but in orthopedics operation theater, there is the main difference is we have to follow the sterile technique and sterile protocols very cautiously.
Very cautiously. Yeah. I have also experience in orthosurgery, like when I assisted the surgeon. So frequently there would be change in the gloves, actually, like that. Yes. If there is a doubt like, this is unsterile. If there is even a doubt like this is unsterile, then need to change the gloves. The whole people, whoever it is, like the scrub, the circulating, the surgeon, and who are assisting the surgeon, even the technician, everybody need to change the gloves. It's like, even in the case of a doubt, like, it is not like nothing intervention or something like that, but there is a doubt.
Yes,
so I have experienced on that. So I think, so that much strict protocol need to be followed.
Yes, sir. Yeah,
in
we can't
orthopedics.
take any. We can't take any chance of
Chances,
getting unsterile. So because of that, we are changing the gloves. If yes, sir, that the same thing you told. One of our surgeons is also telling this, that if you are having any doubt, then it's already unsterile.
Unsterile, if we have a doubt. So not to take any chances in, especially in
Yeah, for
orthopedic
getting any
surgery.
kind of infection, because we are dealing with the bones.
Bones, and bones get, I think,
like
there is high risk of infection.
High risk
for
of
the
infection, sir.
bones.
If once there will be infection, it's like if the infection has got subsided, but it will come after some years again. So that's why we are not taking any chance.
Okay. And I have also heard about the painful surgeries, orthopedic surgery. Is it true? It's
Yes,
for the
sir.
patient. Is it true?
Yeah.
So what could be the reason, like?
So the painful surgeries are the main reason is behind it that it involves the bones.
Bones. And there should be so many nerve endings. And
yeah, so many nerve endings, so many vessels are got ruptured, and the surgeries are very painful because we are using the drill machines. Like we are drilling inside the bones, and
so especially on the post-operative period, there need high analgesics to manage the pain for the patients, right?
High analgesics are needed, like the mainly in after orthopedic surgery, the patients are getting medications like tramadol for their pain relief.
Right. And how common is the fractures actually? On maybe you have a count like this much surgeries I am assisting now per day. So how is the incidence like on fracture? Like how many
like
patients?
Sir, there are mainly the cases which are coming in orthopedics OT, they are because of trauma only. Okay. Like RTA,
road traffic accidents.
Yeah, road traffic accidents, and there are mainly the fractures are of these long bones, like femur fractures, and like tibia fractures. So we are mainly having, and in one day we are having trauma operation theaters also. So in that there are like 3-4 cases are coming every day in operation theater, and in elective OTs are also, but in elective OTs there are elective cases like replacement cases. Or trauma cases are less as compared to replacement cases.
All right. So the elective cases, right?
Yes, sir, the elective cases.
All right. So what are the common challenges in, maybe somebody who is interested in orthopedics department?
Yes, sir.
So there couldn't be that much challenge they will feel actually. Like, but normally when we consider like, somebody needs to be extremely strong while working in.
Yes, sir. Of course, everyone should need to be strong because we are dealing with heavy machines, heavy drills actually. Orthopedics is about drills only. No surgeries
so whether you
dealing
are
without
doing any
drills.
gym or anything for making you strength.
Right now I'm not doing any gym, but I will.
Dealing with the surgery is of course an exercise, right? Orthopedics.
Yeah, it's only an exercise from morning 8 a.m. to 4 p.m. It's like an exercise only. But everyone should be fit for the like in operation theater. If you want to get there, everyone should do gym. Right now I am not doing, but I will suggest everyone to do this.
So means your gym is in assisting with the orthopedic surgeries.
With the surgeons, assisting with the surgeons.
And there will be heavy machines and all, right?
Yes, heavy machines, heavy instruments we are dealing with, and also the heavy lead aprons we are wearing.
Oh, to prevent the lead aprons, right? To prevent from the X-ray radiations coming from the CR machine.
Yeah, we have to stand for, on an average, the cases are of 2 hours, 2 and 2.5. Some surgeries are of long time, like long duration for like 5 to 6 hours. In that also, we have to wear the lead aprons and continue standing for 4-5 hours.
All right. So when we wear this lead aprons like thing, then we could have an intuition like we are going to with the bulletproof jacket and
Yes,
all,
bulletproof
right?
jacket. We are
Because
going
it is
into the
too
war.
much heavy, too much heavy,
Like
right?
that only.
Yeah.
And after that, after completing that surgeries, we are feeling like, oh my God, we are like warriors.
Yeah, because it is. So. How much weight should be? It should be like with the lead aprons.
So one lead apron weight is like 20 to 30 kg.
20-30 kg.
Yes.
Really?
Yes, sir. On an average.
Oh, all right. So we need to bear our body weight and also this 20 to 30 kg lead apron.
Lead aprons.
Okay. So if you are passing some instruments and all, instrument box and all,
Yes,
in a sterile way, so how much kg it should be? Like 40 kg or something maybe?
Yeah, sir. It's more than 15 kg. Each and every boxes are more than 15 kgs. Like the small boxes are 15 kgs and the heavier boxes are more than that, like 30 kgs.
30,
Some boxes are like 35, 40 kgs.
40 kgs.
Yeah, but we have to lift.
You have the opportunity of weightlifting.
Yeah, weightlifting also. It's like an ongoing gym.
Right, regular practice with the weightlifting actually for orthopedics people actually, right. Okay, so what are the other challenges? Is there any mental strain in working?
Yes, some sort of mental straining is there because because the surgery is itself very
Unpredictable.
Yeah, unpredictable, and it needs lots of focus of the surgeon, the nursing professionals, and the team, all the team members. So mainly the scrub nurse who is assisting the surgeon should have to focus a lot, because the surgeon is also under pressure. Because the surgeon needs to perform that surgery within a
is not
fixed time.
going good, then the whole surgery would be, there could be a problem.
There could be a problem. There could be a different complication, and there could be a and delayed time of the surgery, and the surgeon needs to perform that surgery in a limited time, because it will.
So it is a benefit for the patient, right? If the surgery time is limited, means so how much possible if the surgery period is shorter, then it would benefit for the patient, right?
Yes, sir. It will lead to less infection for the patient.
Okay.
It will lead to if we are exposing that surgical site for less hours. Yeah, it will automatically decrease the chances of infection.
And also, I think if the surgery time is reduced, thereby we could reduce the analgesics, the sedative.
Yeah.
Because the patient needs to be on an unconscious stage, or sometimes it would be spinal even, but there is use of sedatives, like, so if the surgery time is shorter, then we could again reduce the sedatives as well.
Yes, sir.
Right. Okay.
Yeah, that is helpful for the patient only.
Okay. And what else?
Another things are like my experience in working ortho is when I got there, I got appreciations from the surgeons and from my seniors. Like they told me that you seems to be very interested in the surgeries and you are learning very quickly. So just keep it up, and it will be very helpful.
So now you know, like which instruments will come on this stage, on the stages of surgery, on this, because if sometimes it is the total hip replacement. So one instrument need to go, the next instrument need to go. Now you know, like on which stage, which instruments need to go, right?
Yeah, because I am assisting the surgeons continuously, like from 4 years. I have assisted the surgeons in total knee replacements and total hip replacement surgery.
And also one more thing I need to ask, like if the THS surgery, total hip replacement surgery, so the stages of the surgery, is it dependent on the surgeon? Like, is there any change if one surgeon is doing that total hip replacement and another surgeon is doing? Is there any difference on the surgery? Like
yes, sir. Every surgeon's approach is different for the surgery. Yeah, the like vital steps will be the same
Vital
for
steps, yeah.
for every surgeon, but the approach will be different, and their
Approach in the sense?
approach in the sense like what kind of uh, prosthesis they want to use.
Okay.
Yeah, what kind of implants they want to use.
Okay.
Okay, these things
The
they
instruments
are
they will
deciding.
use, the instruments they will use like retractors and all,
Yeah,
it will be same.
they will be same.
They will be same,
Yeah.
right? Okay.
They will be same, and the steps would be a little bit different for different surgeons, but the instruments would be same, and we have to focus and we have to observe about the surgeons, like that surgeon is doing it in different way, and another surgeon is doing it in different way. He asks for the different retractor, and he asks for the different retractor. So at that time we have to think about those things.
Okay, so some surgeon need to expose it more, or
Some surgeons are
according to
exposing
the
it less.
situation also,
Yes,
right?
sir, yes, according to the patient, according to the situation.
Situation. And what about surgery in young children, like on the kids?
Yeah, sir. Young children are like mainly the surgeries we are seeing right now are like limb reconstruction. Like the patients, children patient or like pediatric patient who are having like genu valgum diagnosis, and or they have different types of like DDH, like yeah. So in these situations, we are there are expert surgeons, orthopedic surgeons for pediatrics.
Pediatrics.
They are doing different surgeries. Like one surgery name is for limb reconstruction is Elizaro surgery.
Okay.
In that, external fixators are used and applied
for
on
what
the
it is
limb.
used actually for that's what is the indication of that surgery? On what case?
Sir, that genu valgum.
Genu valgum.
Yes.
Okay. So that means simply this feet of the child, it will be coming closer.
Yes,
like,
sir,
right,
like lock.
All right. Okay. So there would be. So you have a got experience with the different types of surgery on different age group as well, like.
Yes, sir, different days, because there are many surgeons will be there who have different speciality. Some are pediatric orthopaedicians and.
So other than the RTA, if there is fall or something like that, on your experience, so is it on younger generation or older generation there is that you have seen like there is for fraction?
Yes, sir.
On your experience, like we have learned, anyway we know like on older age, there would be depletion of calcium and all these levels. That is a theory. But what about your experience on that?
Sir, I have seen mainly I have seen the cases of older patients only.
Okay.
Yeah, we are for getting older patients, and they are like from these RTAs.
Okay.
Mainly, they are getting arthritis, like older patients.
Okay.
So we are getting to operate those kind of surgeries.
Okay, and what about the prognosis and the progress of the progress after the surgery? So, in which age group, on your opinion, it should be like good progress?
Yes, sir. We all know that.
Obviously, like, it would be younger population, and I think on kids the progress would be much more better, right? Because they are on the growing age.
Yeah, growing age. Their immunity is good, and their bones are also in a growing condition. So their prognosis is very good.
What about your teamwork in operation theatre?
So, okay, sir. Actually, I am very fortunate about this, that I have got a very good team. Like in my experience, I have worked with my seniors also, and they have taught me a lot of things. And the surgeons, our anesthesia team, they all have taught me a lot of things. I have gradually I have learned a lot of things, and now I know each and every loophole, each and every about each and every requirement. So these are experience all I have learned from my teammates and from my seniors who are there.
So you are working means if the team is good, then our working culture and all this thing will be extremely the best one, right?
Yes, sir. If there's a good team, the environment would be less stressful for work. There should be a friendly relation with all the colleagues, and we should, like, if there are newcomers are coming. I have got 4 years of experience, but still new people are coming to the orthopedics department, and I love to teach them that what I have been taught by my seniors, and and I also want to motivate them about the orthopedics speciality. That it's a very skillful thing. You would be very skillful after learning all these things. You will feel satisfaction. You will feel good about yourself.
Real work satisfaction after dealing with some ortho cases. Like, yeah.
Like there are so many of cases, arthroscopy, arthroplasty, replacements, these all are. So after learning all these things, I am able to say that, okay, I know these things.
So actually the surgery, the outcome of the surgery is a productive life for the patient, right?
Yes, sir.
So the outcome of this surgery, especially the orthopedic surgery, is a productive life.
Yeah.
It's a very productive
life. Very
productive,
sir.
To the patient, right? And which is the one thing that everybody is interested to learn more about this orthopedic surgery and all.
Everybody is interested in learning about all the new instruments and about the drills, which are very interesting. And
the drills will resembles like a gun, actually.
Yeah,
right?
That is almost like gun only, and it's very easy to handle. Once you got to learn, then it's very easy to operate. So people are feeling like, oh, we have learned a lot of things.
Right. Yeah. Wow. Great things in orthopedic surgery.
Yes.
And what about the...
I also didn't know about all these things when I got there.
All right. Yeah. Once you get immersed in some department only, then you will come to know. Like, go on deep knowledge and skill with a special department. All right. And what are the happy moments of working in...
Yeah, there are a lot of happy moments which I remember. Where there was a surgery in which like scoliosis surgery and like kyphosis surgery, which is a long duration of surgery, and it's a very risky kind of surgery.
How long it will take?
Sometimes it takes like 6 to 7 hours or 8 hours.
Or 8 hours.
Yeah, because there are the nerves are involved during the surgery, and there is a nerve monitoring going on continuously during the surgery. Continuously for the 6 to 8 hours.
Nerve monitoring.
Nerve monitoring.
Okay. So how they will do the nerve monitoring?
Yeah, they are.
Is there any particular instrument?
Yeah, they are like another department is coming for that nerve monitoring. Another speciality of people's from department, they are coming, and they are introducing some electrodes at particular places. And then those electrodes are connected to one computer system, and in that there will be graphs will be there, and at that they will be communicating to the surgeons that these nerves are
not affected.
That. These nerves are doing well.
Means the functioning of the nerve will be constantly monitored.
Yes.
Using a transducer connected to a monitor, like that.
Yeah, right. Sir. So these are when these cases become successful, and after that everyone is happy that and the surgeon is also appreciating you that thank you everyone, thank you to you. So after that we all feel very happy.
All right. So and in this surgery, just because this is very risky surgery, which is this much nerves are involved.
Yeah. Sometimes the child, mainly the child, are getting operated about these surgeries because they are having scoliosis or kyphotic deformity. So this is a kind of surgery. So that's why there's very risky.
And in your opinion, whether the village people and all, whether they know like this is a deformity on the early stage itself? Because I think on my knowledge, if such a disorder like scoliosis, kyphosis and all, if it is treated on an age, like on an age which would be lower age, okay,
Yes,
on
sir.
a
At
small
early
age, at
age.
early age, then it could give good prognosis.
Yes, sir.
So whether the village people, they are aware of this is a deformity, such thing like?
Yes, sir. They are a little bit aware that it's a kind of deformity, but they
Whether they will
don't
seek
know.
treatment on all of a sudden
Yeah.
if they have found like there is a deformity, because I have seen on my experience like the deformity was happened almost 3 years and still they know that there is a deformity and they were waiting for the deformity to to
Get it worse.
get it no, not get it worse. They are thinking like, so the deformity, it will go by itself.
Okay.
There is no intervention, no need of intervention. And I point out this is a deformity. Without any intervention, it won't go like that.
Yeah. Okay. Yes, sir. There are people like who are from remote villages. They are not knowing about that there is a treatment of this thing. But nowadays there are so many surgeries going on, and we have seen some poor patients only. And like so some people are getting information that there is a surgery of these deformity correction.
Okay, so they are getting information from, so somebody have the similar problem,
Yeah.
and they are getting information
the
from them.
surgery.
Yeah, all right. Okay, because it is very difficult for the villagers actually to know
Yes,
about this.
very
There are
difficult
some,
for them.
and also the advancements of surgery, especially like this. There are so many advancements even. So sometimes on older age, it was considered like if there is a damage to the spine or something like that. So somebody have got a fall from the tree and all. So they will just keep the patient like there is no option left like that.
Yeah, because they didn't know about all
But
these
there is
procedures.
advancement in spine surgery, as you know.
Yes, sir.
Like nowadays, there are treatment options for that as well.
Yes, sir.
Yeah.
Many treatment options.
All right. Okay. And working in a team, having good spirit and team spirit.
Yes, sir. Working in a team is I always liked working in a team because there is a different role of every team members, and if we are motivating each and every member of the team, there will always be maintained a good team spirit will be maintained.
Okay.
And
so what is actually required to maintain that team spirit from our side? What is exactly required? Because you are working in a good team and you are motivating people in the team. So what is the main thing? From your experience?
What we have learned in our nursing, the first word which I have learned in my nursing profession is that empathy.
Empathy.
Yeah. So that empathy for the patients, or that empathy for our duty, for our profession, that keeps me motivating. Like there should be, if I am working with my team, and I always tell them that you maintain that team spirit, and for our profession only, to maintain our profession.
So that means if we have empathy to the patient for a good recovery, means we are expecting a good recovery for the patient, then we will place our ego and all the things in a side, and we will communicate well with our team. And whatever which will get benefited for the patient, we will do that all things.
So communication is the most important role. Communication plays a important role. Like what information we know about the patient, what information we are having about any instrument, about any important equipment. So we will pass on those information.
Okay. So for the first time, if some patient is coming to the OT for an orthopedic surgery, and that would be a first time, okay, for somebody to get an accident and coming for this. So on your experience, what would be the common anxiety for the patient? Is it about pain, or is it about the outcome of surgery?
Actually, what I have observed till now in my experience that mainly the patients are telling that just keep me sedated. I don't want to feel the surgery. I don't want to know about the surgery.
Okay.
Like
No, I have asked this question particularly just because I have seen once a patient,
yes.
and on the pre-operative phase of the patient, and he is a villager. The first time he's in the hospital even, and he is telling like, okay, so I am in a hospital now, and I need to have a leg surgery on my leg. So, and I am actually totally afraid of the fact like, so after the surgery, okay, sometimes we could save the leg, or sometimes it couldn't be like that.
Yeah. Sometimes.
Sometimes, right.
Sometimes.
Okay, so, yeah, because if the nerve and all the things are involved, okay, so one of his friend have got a surgery,
Yeah.
and by chance the limb couldn't be saved at that surgery, and it was a massive crush injury for that particular person. But this one was simple actually. It's a simple fracture on the X-ray I have seen. And I have given the assurance like it is not everybody's case, it shouldn't be the same. Like, okay, and we are giving the best treatment over here, like that. So I have just given assurance, but the sense of fear is still there.
Yeah,
actually,
because they are trusting that person more than us.
More than the professionals.
Why,
like, that's a problem. People will seek advice and all the things from friends and all.
From friends and relatives, but not from professionals. They take time to build trust. So that is the case. Mainly, I have observed that sometimes patients are fearing of the outcome, but on a general basis, patients are for pain. Okay. Like so I will feel pain. I will feel a lot of pain.
So whatever you do, just make me painless.
Yeah, just make me painless. I just don't want to feel the
pain. All right. So it could be a general feeling, like for all the patients.
Yeah, for general people.
Yeah, for the human beings. No, it's a normal human being tendency. Like we don't want to get the pain actually for that. So and comparably in India, I think the pain is a big factor actually. In some countries I have seen like the patient will tell like, okay, I don't need the painkillers. I will try the pain actually, but I don't want to get the side effects of the painkillers. Like that I have heard actually.
Yes. Yeah. Some patients are like this also.
Some patients.
Some people are like this also because they think that painkillers are having bad effect.
Yeah, obviously.
And if they can tolerate that level of pain, so they are tolerating it.
Okay. And what are the new advances in orthopedic surgery?
Yes, sir. There are new advances like robotic surgeries.
Robotic surgery. So whether you have any doubt like your job will be taken by the robots in future?
Yes, sir. Okay, this is like a misconception that robotic surgery involves robots, but not. It doesn't involve the robots.
If there is an artificial intelligent robot who could give the instruments in a systematic manner, right? And we are human beings. We don't have that much provision to put the sterlium, hydrogen peroxide, and all these things. But the robots, they don't have any sense or anything like that. They could be more sterile actually. The robot itself could be completely sterilized.
Yes, sir. Yeah. But there's a thing called critical thinking.
Critical thinking. Right.
Like when we are in the mid of the surgery, and if the surgeon requires something, by our observation, because we are continuously working with that surgeon, we have observed him, we know him, that what he will require things or what sign language he is giving to us. Like I am requiring this.
This critical thing couldn't be done by
those robots. So that's why robots can't completely replace the human beings.
We could make the robots as a slave, but not the master.
Yeah, not the master.
Masters.
Yes.
Like that. So, and on robotic surgery, how advanced it is nowadays?
So in robotic surgeries, it's mainly done by machines, and it's very accurate actually.
Okay.
Without robotic surgery, the surgeons are performing with their experience.
Okay.
Yeah, but in robotic surgery, it gives the accurate measures of how much bone should be cut,
Okay.
how much there should be this much of length of implant should be introduced, or that's why
Whether the
they are doing the
robot
robotic
could,
surgery.
with a laser or something like that, the robot could extremely show the measurement to the bone, like this much.
Yes, there are like monitors which shows that these measurements are perfect, and these are the measurements we should do.
Okay.
Like pre-operatively,
So I
it's
think this
got
would
decided.
be much useful for prosthesis implant,
Yes,
right?
yes, sir. Mainly
Okay.
these are for prosthesis
Processes.
implants, for
Because
replacement.
on this processes, how much bone area need to be cut out? Like
Yes,
that,
yes,
right?
sir. Yeah, exactly.
Yeah.
Yeah, that is the robotic surgery.
So it should be give the precise measurement,
Yeah, sir,
right?
for precise.
Precise measurement. Okay. Wow. So our India is also now, advanced that much.
Yeah.
Like any other country on.
Yeah.
That's the conclusion that I could make.
Yeah.
Just because knowing about the robotic surgery in the reputed institutions and
Yes,
all,
yes.
which
Yeah,
would benefit
there are
the
so many of reputed institutes. They are performing robotic
surgery in the orthopedics. And this could, I think, with the robotic surgery, it could save time as well.
Yes, sir. Of course.
To a great extent, right? The time as well. All right. So many things in orthopedic surgery. Is there anything that you need to add upon?
Yes, sir.
Regarding the department, like, is there any challenging factors like that could be, on a negative manner, like it could affect you?
Yeah, sometimes like there is a very chaotic moment. Sometimes there is a very chaotic moment. You don't have that much of time to prepare for the next surgery, and there is a very hasty situation. Like they have
that is
planned
because of the limitation of time.
Right? They have planned to do 4 or 5 surgeries in a day, but they are not getting the time. They are saving like one minute is important, and in that condition, we are also becoming very stressful. We become stressful, like how we will manage the next instrument or
the patient
equipment.
may be waiting, and the patient may be on NPO.
Yes.
And then at that time, it is very difficult to make the surgery on another day.
Yeah.
And need to complete the surgery.
Yeah. The patient
so
overload.
Keeping this quality and infection control on one side, and the time limitation on the other side.
Yeah. Like for infection control, we need some like a particular.
So when it is done, you will think like, oh, I have done a mind-blowing job. Amazing. Yeah. So self-motivation, like amazing.
Yeah. After
it was extremely fabulous. Like
after 8 hours of duty, when we get relief, then we think, oh my God, it was a hectic day, but we have managed it well.
You will get a sound sleep after that, right?
Yeah, complete sound sleep. Whenever I am coming off my duty, and then I am going for 2 or 2.5 hours.
Because body and mind is getting good exercise actually.
Yeah.
That. And then when you see the bed, you could sleep like anything, right?
Yes. If I want
and on another day, you will feel like very refreshed.
Yeah, very refreshed. I want to tell you something about this.
But I have personally observed, like whoever working in orthopedics department, they are very healthy.
Yeah.
Not only physically, but mentally also, they are very healthy and happy also. I have seen, when I have observed people who especially working in orthopedics department, all the team members, when I have looked, like they are extremely healthy actually and happy actually.
It's a kind of cool department.
I was thinking about what could be the secret, and this is the secret.
This is the secret, that they are doing their job, and they are also getting a sound sleep also. I will tell one thing to everyone, that if you want to have a sound sleep, if you are having any problem in like sleeping issues, just get into orthopedics department.
Okay. So that is a warm welcome by one orthopedic department staff, right, to get on the orthopedics department. These are the benefits actually you could consider.
Yeah. And like it leads to a satisfaction inside you, that you are doing a physical work also, and you are mentally prepared for the situation. Somehow you have to manage all the things. And at last you are managing it, and you are getting the satisfaction that okay.
All right. For the viewers, is there anything else that you need to add on regarding the department, any factors, any features, anything like that?
If we are showing some interest in a particular department, then you must learn different skills.
Okay.
Like in orthopedics department, when we enter the orthopedics department, this is my experience that I have become very skillful.
Okay.
I have
So what are
learned
the
a lot
special
of
skills that you need to develop by the time?
Yeah, now I have learned a lot of things. I have developed a lot of skills. Like I am managing my department also, and I want to.
So one thing I think like you could do things within a limited time.
Yes.
Because your cooking time maybe before going into the orthopedics department, your cooking time to say it would be 20 minutes, then now it could be reduced to 10 minutes.
10 minutes.
Half of the cooking time, right? So on each and everything in your life, there could be, you could save the time like that.
Yes. Saving the time is the vital.
That is one skill that you have developed. What about the other skills?
Yeah, the other skills is also that you have to be cool and calm.
No. Okay.
Yeah.
Extremely relaxed.
Yeah, extremely relaxed. Because it will come into your schedule. Initially, when you will come into the department, then it feels like, oh, it's hectic. But gradually, it will become like relaxed. It will be habitual. You will, some complicated situation is like that. Oh, you will think, oh, okay, I'll manage. I'll do it.
All right. Yeah. Okay. So that's the second skill that you have developed, to keep your mind calm.
Yeah. To keep your mind calm, because where we are assisting the surgeons, the surgeons are in the pressure only. At that time, the assisting nurse should be in a calm situation. Because we have to support or we have to coordinate with others to get the surgery done at
the time for the benefit of the patient. And also, I think if you work in orthopedics department, because there could be micro instruments, there could be screws and all these things like that. So I think if you lost something at your home, now it is very easy to find it out, right? After working in the orthopedic department.
Yes.
Otherwise, it would take a long time to find something which was lost in our home and all. But after working in orthopedic department, I think it would be very easy to search for something which is lost.
It's very, sometimes we like in doing our job, sometimes we are not getting some small instruments like you told me, like micro instruments, like screws and all small screws. And that time we are so stressful, like, oh my God, where that screw.
And I have once had, like, one of my favorite surgeon have a, I still remember, it should be almost 8 years or something like that, when I was working in OT. He have told, like, it is not the same screw that we will use on different bone surfaces like that. Some need to be, it could have a good grip on that. And someone which we are placing on the bone, which is not that much healthier, then it would be soft. Like that, something like that. I still remember, like.
Different.
And he is one of my favorite surgeon actually, and he was telling me like this thing.
Some surgeons are there, like they will teach you about every minor details, everything. We have learned different things from surgeons.
I still remember that thing actually. Yeah, really interesting. Okay.
The orthopedics department is very interesting.
All right. Is there anything else that you need to add?
I will like add, like if we are working in any department, we have to celebrate our small happiness after a small interval of time.
So could you recall any incidents that, in your workplace, like some funny things?
Like
for the viewers.
Some, one of the surgeons was there, was a young surgeon, and he performed his first surgery, and we were like, if you will perform this surgery in 1 hour, you have to give that treat and all. So he was very motivated about those things, and he performed that in not in 1 hour, but in 1.5 hours. But we all were
Because
very happy. He was
quality is
also
really
very
important
happy.
actually. It is
Yeah.
not only the time, the quality is also very important.
Yeah.
Couldn't
And we
compromise
celebrated
quality.
his success also.
Okay. So these happy moments will be happened in
Yes.
in the department. Okay. So other than the profession, what are the other things that you will do on your leisure time, like your hobbies and all?
Okay, so my duty hours is of 8 hours, and after coming from my duty,
There will be holidays for you as well, right?
yeah, holidays on Sundays, and on Saturdays I have like half day duty, like
Okay.
it's of 4 hours.
All right.
So I am when I come from my duty, I just do my sketching.
Okay.
Like, I love to do that.
Because that influence of Madhubani, I think, it come over you as well, right?
Yeah.
Because your hometown is nearby to Madhubani. So
Yes.
Madhubani painting is,
And I know Madhubani painting also.
Okay.
Yeah.
Right.
And sketching, and I also love cricket.
Okay.
Like, and I have participated in women's cricket
All right.
in my student time also, and during my professional during job also. And I just love reading novels and reading novels, cooking, listening to ghazals.
So which is
and
your
all.
favorite food?
Like, my favorite food is Alfredo pasta.
All right.
Italian,
So I was,
Italian cuisine.
I was expecting like, something, some traditional, Bihar food I was expecting, but all right. It's okay.
Traditional Bihar food. I am cooking that traditional Bihar food. Basically, I just, on my daily basis, I just want to eat them. But if I am going outside, I just like Italian food and also.
Italian
Yeah,
food,
some
right.
traditional Bihari food. In Bihar, it's very famous, like litti chokha is very famous.
Yeah, yeah, all right. Yeah.
So I like that also.
No, some foreigners even made, videos on litti chokha and all these things. Yeah.
Yes.
There is YouTube channels.
Yeah, it's very
shows them.
delicious actually.
And what about traveling?
Yeah, I love traveling. I have traveled to a lot of places. Like, I have traveled to Rishikesh. It's a very beautiful place.
Yeah, especially Dhanavulti, Mussoorie.
Yeah, Mussoorie is a lovely place actually.
Whether you have visited there on cold season or
no, during spring season.
Spring season, it would be, means the valleys will be full of flowers.
Yeah, it was green.
Have you seen the rhododendron over there?
No.
That red one. Red flowers.
Yeah.
That is called a rhododendron.
Okay. I didn't
which is
remember
used in
that
ancient
name.
times, which is used for treating hypertension actually.
Yeah. I have.
Yeah. But nobody knows, like, so everybody will seeing the red flower will think about something else, which would be on the hilly places, but it is actually a rhododendron. It could, most of the rhododendron could give an anesthetic effect. Most of them actually, but only the traditional people know how to use it, like for hypertension and all like that. Okay. So for the viewers, the orthopedic department, it is actually very interesting, and we have got a professional working on 4+ years in orthopedic department. There are so many advancements in the surgery and all the experience that she have told us, and I'm very happy to have her on the show. And thank you, Sonam. Thank you very much.
Yes, sir.
All right, and please like and subscribe the video. Okay, and keep on watching. Thank you all.
Okay, thank you so much. I am also very thankful to sir for having me on this platform and giving me opportunity to introduce myself and about my department. So thank you so much, sir, and please like and subscribe the channel.